Hi everyone. In this episode today, I'm joined by Dr. Ali Arnaout, a consultant plastic and cosmetic breast surgeon in iQonic Aesthetics in London. One of only a few UK surgeons certified to provide MIA, FemTech, and Motiva preservative breast implants. Dr. Arnaud blends surgical precision with innovation to improve patient outcomes and experiences. Doctor, if you want to add anything in your introduction.
Yeah, no, thanks for having me on this episode. I'm glad to be here today. My practice, as you said, spans across some of the NHS work in breast cancer and the private cosmetic. And as you said, I'm certified in minimally invasive surgery. There's only a few handful of surgeons that can provide a range of both Motiva Mia and the Motiva Preserva breast implants. So we use the latest technology in our clinic, and it's obviously coupled with advancements in IT, such as AI integration, which we'll have a chat about in a second.
Definitely, definitely. Yeah, so starting off with the first question, from your experience, what are the biggest challenges patients face in understanding or navigating their surgical journeys?
Yeah, so that's a really good question. I think what I've noticed more recently is patients have had access to a significant amount of more information. But with a lot of amount of information comes misinformation, especially from AI interfaces such as ChatGPT that might not be reflective of their person. And there's a lot of before and afters are significantly edited that don't reflect, true representation of what can be achieved realistically. And there's a lot of TikTok videos that have these quick fixes that are not, so
Yeah,
realistic. So a lot of patients come with a slight misunderstanding of what the journey is going to be involved, some emotional uncertainty with associated anxiety, and I would say an expectation gap. And we need to kind of address that misinformation and tailor it to the patient.
sure. And I believe that in the world of Chat GPT, where patient, came prepared with some sort of information from TikTok or Chat GPT. So I just wanted to understand, how do patient expectations around cosmetic outcomes differ today as compared to a few years ago? Yeah,
Yeah, so now because they have a lot of information available really at the fingertips, some of it might not be representative. So we have patients that come in with perceived ideas that kind of don't really fit in what can be achieved for them and doesn't take into account their own anatomy. So to kind of mitigate that in a way, we've introduced a lot of advancements in our clinic. So we have multiple systems, but the main one that we use is called Adorial. And the Adorial software is a great platform. It's a one-stop tool that kind of takes the patient experience from end to end and helps mitigate
hmm,
that misinformation. So on that system, there's a silhouette tool that the patients can put in their goals, concerns, expectations, and inspirations, and then allows me to talk them or walk them through the consultation with knowing what their priorities are. And then in that software, the Adorial has integrated a 3D app called Chrysalex, which we can talk about, and it's an AI tool. So maybe we'll come back and talk about the integration of technology into the clinic and specifically the 3D tool. But the nice thing about the Adorial system is it provides full transparency in the patient journey. And I think a lot of the information that we give them that's tailored to them allows them and empowers them with knowledge that can take them onto an appropriate journey with great results to the end.
definitely. So you mentioned about 3D imaging, right? So I just wanted to understand, do you use visual simulation tools or 3D imaging during consultation, and how does that change the way patient understand their outcomes of the surgery, basically?
Yeah, I think the 3D tool, which is an AI simulation of the before and after, has been a very empowering tool for the patient and a huge asset in the clinic. So when they come in, we do a personalized 3D. So obviously they take a couple of photographs, and that generates an augmented image in 3D, and it allows them to see from their own anatomy, so it's very personalized to them, the before and after, so they can look at different implant sizes, they can see if they need a lift and how, for example, a breast lift would change the outlook. And then that takes the conversation to more reality-based instead of just talking about guesswork. And then the patient can understand what is achievable, what isn't achievable with their body type. And I think, that provides a huge confidence boost between me and the surgeon, and it improves the dialogue that we have. Now, what's pretty cool, I think, more recently we have in our clinic not just the AI tool that allows us to do the 3D, but also augmented reality headset. So the patients put on these headsets and it uses the 3D simulation so they can see in first person. So then they look around and they can see on their chest how the implant looks, how the shape would look. And I think that's the next level of empowering patients with not just looking at the screen, but looking at it almost in an augmented reality as a direct simulation. So AI has definitely taken that to the next step for sure.
Definitely. And I think a lot of time of surgeons goes into guiding patients through, preoperative and postoperative care. So I just wanted to understand from a surgeon's perspective, that what role do you see AI in guiding patients through pre-ops and post-ops?
So one of the main things of like guiding patients is obviously, and I think AI lacks it, is the emotional intelligence and being
Mhm.
available and directing them with accuracy. So it comes down to like also documentation. So it's communication really, whether it's verbal or documented. So we
Yep.
also integrated some AI into that pathway. So coupled with the Adorial platform, which provides complete transparency because any communication that I have is documented there. But we also use this AI clinical scribing software called Heidi, which is a great tool because Heidi is an application that you can have on your laptop or computer during the consultation, or on your phone, sorry, and then that allows me to be fully present in the consultation. So I spend, my whole time listening to the patient and providing them with the complete clinical care and guidance that they require without having to kind of worry about, I need to remember this point or sit there on my computer and type. So it's not just saves me time with admin, but allows me to be present there for the patient and understand their needs, so then to provide them with accuracy in their pre-op and post-op. The cool thing about Heidi is it doesn't really record the conversation per se, but it just transcribes it. So it provides really accurate details of what we discussed, which provides transparency. I think it improves the communication and the confidence between us.
Mm, definitely. And I think there's a lot of like gap between expectations and reality of the patient outcome. So I just wanted to know that do you think AI could play a role in setting realistic expectations, and not just visualizing the outcome as you mentioned through these 3D tools?
Yeah, no, absolutely. I think now with a lot of people using AI to change or enhance some of their photos on Instagram, especially, celebrities might use it, touch-up tools, whether directly or indirectly, when they are publicized, especially by, high celebrities or high-profile celebrities, that gives the patient some unrealistic expectations. So it's very important to use everything that we kind of discussed in terms of the journey with them from the pre-op, using all the pictures that they have, the simulations, the accuracy and documentation about their specific anatomy, to direct them towards what is an AI augmentation that isn't realistic to an AI augmentation that is accurate and representative for them, and what realistically can be generated from surgery and what is impossible to generate from surgery and is purely AI. So having a distinction between reality and managing patients' expectation is really kind of coupled with a great communication between the surgeon and the patient, and with the Crystal X and having the transparency on Adorium.
Definitely. So let me ask you a fun question. So if AI could become your digital co-pilot at your clinic, what would you want it to do? And how would your day look like?
So I think AI is here already. I think, I use AI as my co-pilot pretty much as I said before. I think, Heidi has been my AI co-pilot in terms of transcribing. It will be great to have like an actual uh, more autonomous representation in AI in doing the kind of not just the photo regeneration, but in the post-ops care and providing, different pathways for recovery. But the main thing that we have to also remember so far with AI is the lack of emotional intelligence, and you have to provide patients with compassion, and listen, because that's the most important thing in making sure they have the good result is listen to what they need. But I think so far we have integrated a lot of AI in our clinics, and we're definitely ahead of a lot of other clinics, especially in the UK, with our integration of AI. Now, what I can see in the future is more kind of doing remote stuff, and we're already doing like virtual clinics, and using the 3D software. But by introducing more automation of the admin side, especially, will take away some of our burden in the future. Um, but I think, AI will just get better and better.
Hmm, definitely. And what's the one advice that you will give to people who are building AI from surgeon's lens?
So I think building AI depends on like what aspect of building is needed to kind of integrate it within their own clinic. I think having a communication tool that's very transparent is essential. So if they're building a new tool, making sure that they listen and generate an empathetic summary,
Hmm.
that is, to help guide the patient towards realistic expectations. I think what would be a great tool to build is an image scanner to see when some patients come in and say, "Oh, I want to look like Kylie Jenner, for example, who has been like a
Hmm.
high profile celebrity who's said, I've gone in and put breast implants." But sometimes these high profile celebrities won't come and say, I've had X, Y, and Z done. So it'll be nice to have like an AI fact check in a
Hmm.
way where they can scan images and say, these are the possible things that this patient has had. Obviously, you have to compare multiple photos for an AI to do that. And I think that helps the patient in a pre-consultation setting to say, okay, the photos I'm looking at of these celebrities aren't real and they're not realistic. They have been modified heavily. And that should be a red flag. So then they can find different inspirations of patients who have achieved, a realistic outcome from surgery, or they have said, well, you know what, I've had this surgery and this is what the implant I've chosen. Obviously, that's unique to them because that's their frame and anatomy. But, matching maybe that person's anatomy to a degree with the patient, and then they can say, have a look at X, Y, and Z celebrities, they match you a bit more, and this is potentially a realistic thing that you can achieve. It's a bit more complex because there's a lot of probably GDPR
Hmm.
rules
Yeah,
around it, especially in the UK. Um, but that'll be like a great AI tool is to see what is realistic and not realistic from a high profile celebrity.
definitely. Well, thanks, doctor. It was really great speaking to you, and it was great knowing more about you as well and your clinic and your views on how AI could improve patient satisfaction.
No, thanks for having me. I think it's been a great talk. I love talking about this topic. We integrate it in our daily practice, and I think it helps patients significantly. So thanks for inviting me on this webinar and having me talk about topics that I absolutely love.
Definitely, definitely, doc.
Thank you very much.